Hello everyone. Today we are going to learn about the approach to the appendicular tumor. So let's start with the discussion. So the appendicular tumor can be found during the surgery or it can be found on the post-operative period on the histopathological examination. So let's see the if the tumor detected during this surgery and the tumor can be detected on histopathological examination. So let's see the approach when the tumor is detected during the surgery. So if the tumor is detected during the surgery, the first thing you should know about the tumor is the size of the tumor. So what is the size of the tumor? If the size of the tumor is more than 2 centimeter, then we should do the right hemicolectomy. Should do the right hemicolectomy. But if the size of the tumor is less than 2 centimeter, then we should know about the what is the status of the base or the status of the mesoappendix. Is it involved or not? So what is the status of the base? It is base involved or not? The mesoappendix is involved or not? If the answer for this question is yes, then again we should go for a right hemicolectomy. If the base of the appendix is involved or the tumor is infiltrating into the mesoappendix, then we should proceed with the right hemicolectomy. But if the base of the appendix is not involved and the mesoappendix is not involved, then we should see that is it perforated appendix or not? If perforation is there or not? If there is no perforation, then the appendectomy is sufficient. If there is no perforation, the appendectomy will be sufficient for the particular tumor. But if perforation is present, then we should know the characteristic of the spillage. If the spillage is mucinous spillage is there, spillage is present, or mucinous ascites is. If this is positive, then we should go for appendectomy plus peritoneal lavage is given and patient should be referred for cytoreduction surgery plus IPEC, because there is a possibility of the pseudomyxoma peritonei. But if there is no spillage or no mucinous spillage or no presence of a mucinous ascites, then only appendectomy is sufficient. So this is the approach for the when the tumor is detected during the surgery. So just see, first we have to see the size of the tumor. If the size is more than 2 centimeter, directly proceed to the hemicolectomy. If the size is less than 2 centimeter, then we should know about the if base is involved or not, or mesoappendix is involved. If mesoappendix and base is involved, then we should again have to go for a right hemicolectomy. But if base is not involved, mesoappendix is not involved, then we should look for the perforation. If there is no perforation, only appendectomy is sufficient. If there is a perforation and it is a mucinous, suggestive of mucinous spillage, and or there is a presence of a mucinous ascites, then we should go for a appendectomy plus peritoneal lavage is given and patient should be referred for a cytoreduction surgery, cytoreduction, yes, cytoreduction surgery plus IPEC, because there is a possibility of the pseudomyxoma periodonta. But if there is a no mucinous spillage or the mucinous ascites is there, then only appendectomy is sufficient. So another situation where the tumor is found on the post-operative period on the histopathological examination. So let's see this. If the tumor is detected on post-operatively histopathological examination. So the histopathological examination will show the type of the tumor. So it can be a adenocarcinoma of the appendix, adenocarcinoma of the appendix. It can be a neuroendocrine tumor of the appendix, or it can be a appendicular mucinous neoplasm. Among these, the neuroendocrine tumors are the most common variety, which is constitute for the 65% of the all appendicular tumor. Adenocarcinoma is occurring, incidence of the adenocarcinoma is about 0.1%, and the incidence of the appendicular mucinous neoplasm is around 10 to 15%. So if the histopathological examination shows that it is adenocarcinoma, then we should straightly go with the right hemicolectomy. Then we should proceed with the right hemicolectomy. But if the histopathological report is suggestive of the neuroendocrine tumor, then we should again look for the size of the tumor. What is the size of the tumor? If the size of the tumor is less than 1 centimeter, if the size is less than 1 centimeter, then just we have to do a observation, because appendectomy has been already done and we just have to wait and watch. But if the size of the tumor more than 2 centimeter, then we should again have to proceed with the right hemicolectomy. But if the size of the tumor is in between the 1 to 2 centimeter, means size between 1 to 2 centimeter, then we should know the two important characteristics of the on histopathological examination, that is lymphovascular invasion is there or not, and there is a involvement of the mesoappendicular involvement. Is there lymphovascular involvement is there, or the mesoappendicular involvement is there? If the mesoappendicular involvement is there, that if there is a mesoappendicular involvement or the lymphovascular involvement, then we should proceed with the right hemicolectomy. And if there is a no involvement of mesoappendix and then lymphovascular involvement is not there, then we should do observation. So if the tumor is of about appendicular mucinous neoplasm, then we should know, that is, if it is a low grade tumor or a high grade tumor, depending upon the histopathological characteristic. If the appendicular mucinous neoplasm is of high grade or low grade. If the appendicular tumor, appendicular mucinous neoplasm is of high grade variety, then we should go for right colectomy. plus cytoreductive surgery plus patient should be referred for a HIPEC surgery. HIPEC. Because of there is a high chances of the pseudomaxima peritoma. Then in case of a low grade tumor, then we should see the margin of the appendix, base is involved or not. We should look for the, if the size is more than 2 centimeter and the mesoappendix is involved. If the answer for this all question, if it is yes, then we should proceed with the right collector. If the answer for this question is no, then we can observe this type of tumor. So this is about the, if the tumor is found on the histopathological examination of the appendix on postoperative period. So let's see, revise this. Histopathological examination will show the nature of the tumor. It can be adenocarcinoma. If adenocarcinoma is there, we should directly go for right hemicolectomy. So if the tumor is neuroendocrine tumor of the appendix, then we should know the size of the tumor. If the size is less than 1 centimeter, we should we just have to wait and watch, that is observation. But if the size of the tumor is more than 2 centimeter, we should do the re-exploration and do the right hemicolectomy of the patient. But if the size is in between 1 to 2 centimeter, we should look for the lymphovascular involvement and the mesoappendicular involvement. If there is a presence of lymphovascular involvement or the mesoappendix is involved, then we should go for a right hemicolectomy. If there is no involvement of mesoappendix and the lymphovascular, there is no lymphovascular involvement, then we should wait and watch for the tumor. So, and if the tumor nature is appendicular mucinous neoplasm, then we should look for the histopathological characteristic. That is, it can be a low grade tumor or a high grade tumor. In case of a high grade tumor, we should do a right colectomy plus cytoreductive surgery plus patient should be referred for a HIPEC. And in case of a low grade tumor, we should look for the margins. If margins are positive or not, base is involved or not, size, if the size of the tumor is more than 2 centimeter, the mesoappendix is involved or not. If the questions for all that, the answer for that all question is yes, we should go for a right hemicolectomy. But if the answer for all the questions seems to be a no, then we should do observation. So this is all about the approach to the appendicular tumor. It can be during the surgery or the tumors found on the histopathological examination. Thank you.